Oh, that's the fan.
There we go. Hi, folks. This is Diego Ochoa. I'm Superintendent of the San Mateo-Foster City School District. I am delighted to be joined here by friends and colleagues here in our district. Seated to my left is our Chief Business Official, Mr. Patrick Gaffney. Seated to my right is the very proud principal of Baywood Elementary School, Amanda Driscoll.
Good evening, everyone.
And next to Amanda is our Director for School Facilities and Construction, Amy Rufo. Amy, how you doing?
Great.
Good. It's good to be with you all. Amy's our surprise guest. She didn't make it onto the email that we sent out, but we're happy to have you, Amy.
Thank you for inviting me.
Good. And we have a handful of items that we're going to discuss just to start off tonight's event. Our focus is going to be, again, the coronavirus and air quality in the San Mateo Foster City School District. And what we're going to start off with is a series of topics that actually related to our last event that we held last Wednesday. I'm joined again here in the room by our communication specialist. He's on the scene, but he's off camera. His name is Diego Perez, and Diego puts a lot of work into making this event possible. So let's give him a round of applause. The other person that is on the scene but off camera, he can't really sneak up on anybody here at the district office. He's 6'9", and he's our director of technology, and that's Peter Kazanis. So Peter, thank you very much for helping us with this event too. I know he's watching from the control room over in the technology department. So where we're going to start is where we left off at our last event, and it's starting with the air quality guidance that we've received from the state of California, and really following up on an extended conversation that we had on September 9th at the school board meeting that took place. And really what it concerned was how the district manages the way that we respond to the change in air quality. So for folks that haven't seen it, we sent this document out to families. We're going to have this document on our district website. We sent this document out to families. It's pretty easy to see from here. It's color coded. And basically what it describes is what happens when air quality goes from good to moderate and crosses into a category called unhealthy for some groups. And the students and staff that fall into the some group category are individuals that, for instance, have a case of asthma, or individuals who have respiratory disease or respiratory illness. It's very young children who have immune compromised systems. And these are individuals who we are aware of, and there may be others who have developed a condition over, say, the last summer or over the last year. And we really want to start by encouraging families to contact their school office. Let them know if something medically has changed, because I think it's very important for us to know that information. Amanda, you're there at Baywood. When a medical situation changes for a child, you're the principal there. What do you want the parents to do? How do they actually follow up on letting you or the school staff know what has changed for their child?
Great question. So we welcome any form of communication in person in our office or via email, but just simply letting us know the change in the medical condition, perhaps providing, a letter from the doctor that states, what the concern is for that individual student. And then we can record it in Aries, which is our data system where we keep track of all this important information.
And it's confidential.
And it's confidential. Yeah, so and actually at the start of every school year, we receive a list from our nursing department that includes all students with, and includes any sort of medical condition that we should be aware of, whether that's an allergy or asthma. And then in particular, we receive a list that only contains students with conditions that we want to be really mindful about in regards to air quality too.
Yeah. And you and your staff are actually trained in reaching out to the district's nurses. So when a family comes in and they give us a doctor's note that's contains some very serious medical implications, you'll pick up the phone and you'll call the district office.
I will. I'll call Susie Riley, and we work closely with Catherine Lee, who's one of our 4 district nurses as well. And I'll share the information that parents share with me. But most often, we just set up a meeting right away so that we can discuss, what are the supports that we need to put in place right away for that particular kiddo.
Yeah. Now, the air quality guidance has this color coding that once it gets to an orange level, they call that unhealthy for some groups. And then the next range over is what they just determine as unhealthy. So whether you're in a compromised group or not, the guidance from the state is unhealthy air impacts everybody. This level of unhealthy air. So we got a lot of questions during our last event, and we do have the live chat posted. We want to encourage families who are watching to enter in live chat questions. We like those questions. It helps us get better at what we do. So our wonderful communications specialist, at the end of the event, he turns that into a spreadsheet. And myself and Patrick went over those questions one by one to just sort of think about them a second time, to really check to see, in the moment we heard something, but now a couple of days later, let's reread it and see what they were really asking. So we got a couple of questions from a parent who said, when are you going to shut the doors to classrooms? When are you going to keep kids in for recess? When are you going to keep kids in for lunch as opposed to sending them out? Amanda, you're here as a representative for one of the schools. Where do kids normally eat lunch at your school?
Great. We have several lunch courts now across our campus, designated by each grade level, and those are all outdoors currently. In the event that we needed to move lunch indoors, it would take place in classrooms.
Yeah. So right now, I was just at your school. As for those parents who didn't know, this is the week to highlight and celebrate Baywood, those mighty, mighty owls.
Go Baywood.
Go Baywood. So Principal Driscoll identified, I think it was 15 or 20 people and students who you recognized as either Shining Stars or one SMFC award winners or Kindness Award winners. You may have also recognized them for their all-in commitment to the district's mission and vision. And while we were there, we basically went from sort of hallways that lead into classrooms, right? That many of our schools have classrooms that are out in the open that you walk into, but your school's a little bit different because you've got numerous classrooms that are built into multi-level buildings.
Correct.
And each classroom is its own space. So at your school, I can sort of see how we would operate lunch. We would get those lunches in, we would keep the students in there. For us, that designation happens when we get into unhealthy for all. That's 150 AQI or air quality index points. And that is an area where you start to see things like recess indoors, where you start to see things like no PE outdoors. Now, I didn't go in there, but it looked like your school does have an indoor place that your kids could do some PE. Is that
correct? Yeah, we can do some PE in our NPR. However, when we shift on rainy days, for example, or in the event that we were in the red or the unhealthy area, our PE coaches would go directly to classrooms to provide physical education.
Yeah. I think there's a lot of that on the spot change, on the spot
Absolutely.
implementation that happens. At the same time, this same chart will take you to the purple category, or what they call very unhealthy. That's at the 201 air quality index level or 201 AQI level. And that's where my recommendation to the school board is going to be that we consider closing our school campuses. That's not a decision that we take lightly. It's very difficult to determine why or how you would choose to close a school. So I want to give a couple of examples. So let's say tonight is Wednesday night, and on our air quality websites, it states that tomorrow will be at 275 air quality index. Tonight, I would send an email to all the families announcing the closure of schools tomorrow, because parents need to plan. Parents need to contact employers. Parents need to basically let people know that they can't be at work the next day, or that they're arranged to have family or neighbors or some system to have their children supervised the next day. Having said that, many days don't work that way. Many days, you think the air quality is going to be, say, 165 in the unhealthy range, but not in the very unhealthy range. And then you get to about 11 o'clock in the morning, and suddenly it's 205. Now, it would be chaos to close schools at 11 o'clock in the morning, and I will not do that because I can't put children in harm's way. We can only anticipate a school closure. A more likely result would be we would shelter in place. We would keep kids indoors until the end of school when parents already expect to come and pick kids up. And that's why every day is a little bit different. Um, what I'll recommend to the board is that I be given the discretion to make that decision based on a variety of factors. We haven't faced any days yet that are solely in the unhealthy range, but fire season is just beginning, and it's likely to continue all the way through the end of November. That's about when fire season really started to slow down historically. So we've got a couple of months to go. And when we arrive there, the recommendation that I'll be making to the board is 201 is the time where I would make the decision to close schools, knowing that I likely won't do it if the air quality index exceeds 201 after we've begun school. Because none of us has a crystal ball. None of us can predict 100% what is going to happen in 12 hours or 24 hours. So we could have a plan to have kids in school tomorrow, but if it unfortunately exceeded 201 during the school day, I won't close schools and send kids home. It's very unlikely that I would do that because it would be chaos. There would be kids all over the place with nowhere to go. Now, if I can tell you the night before at 5:30 or 6 p.m., then that gives you some time as a parent to make some decisions. We're also very concerned about the education kids receive, so we're putting some pieces together to make sure that kids have their Chromebook, that kids have their access to technology, that they're able to jump online, continue to do some learning. Maybe not a typical school day, but some learning would take place. And our approach is to basically be prepared for any possibility, and that's where we take it. During the town hall or the YouTube live stream last week, we got a lot of questions about where we stood with some planned HVAC or air conditioning system upgrades. And so we've got Amy with us tonight, and we have Patrick with us tonight. I'm going to start by asking Patrick to talk a little bit about the update we gave on May 6th. The three of us sat down and actually reviewed it together to really go sort of step by step and make sure that we were on track with that update. So, Patrick, talk to the families, talk to the community about where we stood on May 6th and where we stand now in terms of being on track with our project.
So we have several projects that we talk about, but we want to first start about the HVAC project that Amy can provide some details on as well. Since May 6th, we have entered into contracts with ADIS Architecture to look at the second phase of the HVAC project, so additional sites to have the HVAC installations installed. And we've got a list of those particular sites to share too, if folks would like to hear that information. And at this point in time, for the phase one group of schools, we have submitted those plans to DSA, and we expect to get those set of plans back from DSA this month. And that will permit us to move forward with contract, or take out to bid those particular projects.
Can I stop you there?
Please, yeah.
So in May,
Yeah.
we told the community that we were going to basically request, it's like a way of submitting a plan, but also kind of requesting that they review your plan. That's what DSA, or the Division of the State Architect, does.
Right.
You tell them what you want to do, and then they have engineers and architects and environmentalists that basically they go over your plans with a fine-tooth comb, right? So what you're saying is, we told the community that we were going to do that, and we did it.
Exactly.
And it's basically, we're kind of awaiting some kind of response or approval to move forward.
Absolutely right. And once we get that set of responses back, sometimes it's an exchange. You go through it a couple different times, and Amy knows this from all her years of experience in doing this too. But it leads us to having a set of plans that we can take out to bid and bring in a partner with us to move forward on construction for the upcoming summer. And what we want to do is take that out to bid sooner rather than later. We want it out to bid in the December timeframe for projects 6 months later, right? So we'll have a much richer pool of folks bidding those projects.
And the schools that you're talking about, it's George Hall,
right?
It's North Shoreview,
Right.
It's Laurel,
Yep.
College Park, Meadow Heights, Abbott, and Burrell.
Right.
And those schools are basically slated for June of 2022 to actually have these contractors come in and install brand new, right? That's
right.
what we're talking about.
And these different phases we talked about last time, the first phase are those sites that have no air conditioning today. So that's our first set of folks, and looking at some of these folks that have grades 6 through 8 and into their pod schools. So that's our first phase we're going through. And then phase two, we've got some additional sites to talk about as well. We talked about that last time too. So, but we're on track for the
What you're saying is George Hall, North Shoreview, Laurel, College Park, Meadow Heights, Abbott, and Burrell. You're calling those schools phase one.
That's right.
And those schools currently don't have air conditioning.
That's right.
And we're going to install those at those schools.
That's right. Exactly.
In every classroom.
That's right. Every classroom.
That makes me, you can't see, but that makes me happy.
It's a big project.
It's a big project.
It's big.
So then,
a short window of time too.
So what we heard during the event last week was, we hear you. We know that plan is happening. What is the plan for now? What are you doing now to safeguard our children's health and well-being? So talk a little bit, because I have this.
Right.
My colleague over here, Diego Perez, put together another classic Canva that we'll be sending out at the end of the week. It's a visual that basically explains, we have a product that we use called the Winix D480 True HEPA Air Purifier. And it basically operates in a way that it captures particles in the air. It actually brings the particles in and it filters those particles.
Right.
And it does so in a way where in our classrooms, we have 2 of these devices in each classroom.
That's right.
And so when it does that, it's actually circulating the air in those classrooms. And it's rated at a very high level, in addition to what you have described as the MERV or MERV, 11 or 13 filters, depending on which school you're talking about.
That's right. That's right. Yes, we talked about it the last time. So we've got once COVID began, the CDC or Centers for Disease Control and Prevention and ASHRAE, which is American Society of Heating, Refrigeration, and Air Conditioning Engineers. I think that's what the acronym stands for. Came out with a set of suggestions, and we responded to those suggestions. We converted all of our MERV 7 and 8 filters to 11s. And we also converted anywhere we could put a MERV 13 filter in, we put in, and every place else we put in a MERV 11 filter. So we have about 30% of our district has MERV 13, about 70% of our district has MERV 11s. And so both of those entities, what they recommend is you take this layered approach to mitigate the risk of the transmission of COVID. So your first purification goes through the MERV 11 filter with your outside air being drawn through that filter. That same air is cycled through with the superintendent was just talking about. Those 2 air purifiers have HEPA filters in them. And that's intended to address those particles, as you say. So that's the 2 steps we've taken to date.
Now, Amy, you come in on the construction side, so walk me through the process that will happen once we hear back from the Division of the State Architect. We sent them those plans in May or June. They're doing their review of those plans. When they give us the green check mark, what happens next?
So we're right about to get the green check mark or the stamp receiving approval. Once we have approval, we will what we call go out on the street, which means we're we're going out to bid. And we will talk to various contractors to advertise our project. Since we're working at 7 sites, it is quite a large project. So we really want to make sure that we talk to many vendors to get enough excitement that we receive good bids. We are also looking at the possibility of.
And can I interrupt you there? When you say good bids, you mean good proposals for them doing the work for us? Because what we submitted to the state architect was a very good description of what we wanted to be done. But now we actually have to turn to the business community to find a company that wants to do that job for us.
Correct.
And meet our specifications. And you're calling that a bid, but it's really a proposal for work.
Correct. When I say good, on or below budget is good with a qualified vendor. So this is going out to a public bid. And our goal is to get, at least 3, maybe more, bids to then open and review. Right now, we've all heard about the shipping shortage and what's going on with getting materials. So we want to make sure we go out early so we can get the equipment starting to be shipped to the West Coast. We need ductwork, we need mechanical equipment. Having that a stage and arrive early. We have breaks throughout the year. So the earlier we bid, the earlier the contractors can start that planning work in the room and get work staged and ready to be installed once the kids leave for summer.
Once we get those responses back, we hire somebody, we select somebody.
Correct. We then bring it to the board for approval. So we would then show the bid tabulation, showing the board that we went out to bid, we received XYZ bidders. This is the lowest, most responsive bid that we recommend awarding to.
To use very round numbers, We ask somebody to build us something. 5 people respond to us and tell us that they want to do the project. One person says, I'll do it for 2 million. One person says, I'll do it for 3 million. One person says, I'll do it for 4 million, and so on. We basically review the bids to make sure that they can do the work we're asking them to do. And then we basically choose the lowest bid. It's kind of our way of giving the best value for the money that we're using to complete the project. So that's what you're describing.
Correct.
Yeah. And it's never that I mean, it's never that clean or easy.
Uh-huh.
Yeah, there can
I'm
be-
making it oversimplified.
Uh-huh.
There can be discrepancies, so we need to review it, that whatever we're bringing to the board is the most responsive low bid that we received.
The board approves it, then what happens?
Contracts are then signed, equipment is ordered, and we will start what we can do before the kids leave for summer break. But once the kids leave, it's gonna be teams of people arriving at these 7 sites, removing the old equipment. We're adding ductwork. Currently, the equipment sits in the corner and air just blows from the corner of the room. We're adding ductwork so we could spread out that air, get good circulation throughout the space. So then we're building a closet to put the equipment in so it's not too loud.
Yeah.
Because we're very understanding that we don't want to make learning harder in the rooms with a loud fan. So it goes in a closet so it's quieter. And then once the equipment is in, we commission it to make sure that it's working per plan and we're getting the correct air exchanges, and that we have all of our controls to read the air in the unit, that it's at the correct temperature. And then we're ready for the kids to come back and we have air conditioning.
We've got some questions that are starting to come in the next 10 minutes or so. I'm going to start reading those questions. Some of them pertain to the topic of air quality, the topic of school construction pertaining to air quality. But we also have some updates regarding pooled testing, and we have some updates regarding COVID cases in the school district. So as you know, the district is on a daily basis monitoring COVID cases. We published online a week ago our 4-week COVID data. It showed that in the 3rd week of the school year, we hit our high mark with 21 cases. And the 4th week, it had a drop down to 17 cases. I can let folks know that the 5th week of school, it dropped to 16 cases. And as of today, for the week, we are down to 5 cases. So we're feeling very hopeful. I think a lot of us have butterflies in our stomach about this weekend because it's 4 days of no school. And what our data tells us is that many of the cases, the vast majority of cases, are tied to behavior outside of school, not in school. Now, I've got 21 schools, Amanda, so I don't remember if we've had a case yet at Baywood.
Had one case.
Yeah, talk about what your perspective as the principal, you had that case. What happened? How did it, what do you recall about what that meant for you as a principal and for the school?
Great. So I think the most important piece when you learn of a case is really getting in touch with our district office staff. So connecting with you and Susie Riley and our nursing team, but then more importantly, connecting right away with families, informing families that we have had a case, and then giving families the resources they need to begin a modified quarantine and complete COVID testing. I think for me, it was, the data that came back, right, when I watched our one class that was impacted by this over the 10-day period, receiving those test results back that the additional students in the class received negative COVID tests. It was reassuring that the mitigation practices that we had in place were functioning appropriately.
Did it lead to a second case?
It did not. So
I
this is
mean-
an indication that the hand washing, spacing as much as possible, wearing our masks indoors and outdoors as well, is working.
And how many kids go to your school?
539,
And you had one case
one case,
in 6 weeks.
correct.
I'm not a mathematician, folks. I'm just a lowly superintendent, but I think that's a really good percentage.
Me too.
When you walk on campus, what do you see kids doing that you think leads them to staying safe?
Great question. I see all of our kids wearing masks and being mindful when they're not wearing a mask, if they're eating at their lunch table. You know, we've put some practices in place to help them recognize that spacing with a visual reminder like a sticker or a dot. And being mindful of when we have our mask off, that's the time that we allow appropriate spacing. Lots of hand washing. I see teachers each and every day building in additional time because it does require additional time to incorporate the hand washing, you know, at transitions before entering and when exiting classrooms. So all of these things, again, I didn't mention the adults. Our adults in the community are modeling wearing masks as well, and our little ones look to us for examples, and I think we're doing a great job as a community modeling those expectations.
I think so too. I went to your school, as we discussed earlier tonight, just the other day, and I just saw a lot of adults doing the right thing. And children are always watching adults to see what the rules are, to see how to behave, to understand what steps they need to take. And I think the Baywood families and the Baywood staff really deserve our appreciation and our respect. When I look district-wide, I think it's probably true at all of our schools. Our Laurel families are doing a good job, our Abbott families, our North Shoreview families. We just have so many schools that have been doing so many good things to keep those cases down. And even schools where we had a rise in cases in the first and second week of school, we've seen that come back down at the end of this process. Diego, you're off camera, so I won't expect you to respond, but you can give me a thumbs up. We are actually looking into expanding or continuing our evening testing. Have we heard back yet?
We're waiting on the contracts.
We're waiting on the contract. So what I can announce tonight is that we have a handshake agreement. We always want to get it in writing, but we have a handshake agreement to continue the evening testing that we've been doing district-wide through the end of October. So that is at, help me out here, folks, Sunnybray,
Abbott,
Beach Park, Abbott, Foster City,
George Hall.
George Hall, and others, because I don't have it.
Yeah.
Fiesta Gardens, all of our schools that I just listed, they have evening, well, really they start at 1 o'clock, but evening COVID testing because it goes until late in the afternoons, evenings. And we're going to continue that because we believe that that has had an equally positive impact when you connect it to hand washing, when you connect it to hand sanitizer, which is on the table here. And I don't know, folks, if you can see, but we've got some Greek pastries that are here on the table. If you haven't been to the district office, we're located in Foster City on Chest Drive. And I have a particular soft spot for this coffee spot just over the bridge called Penelope's, if you haven't heard about it. Those are not necessarily your typical biscottis, but they're very good. They're very, very good. So we had some of that earlier today. And what we're going to do is we're going to continue the layers of mitigation. The hand washing, the distancing as appropriate, the contact tracing, the COVID testing, and again, what we have starting next week is we have pooled testing starting next week. And this is a document that we've sent out via email to families multiple times. And we're getting closer and closer to launching it. We expect to launch it Monday, September 20th at schools in the district. About half the schools will be on Monday, the other half will be on Tuesday. I actually think there's one school that will be on Wednesday, so we'll have some information for that school coming out. And the reason that we're doing this is because we're looking for that additional mitigation to make sure that as we go into cold and flu season, that we just have one more strategy that layers on top of all these other strategies that helps us keep the spread down. So, Amanda, you're the principal at Baywood. You've got 500 and some odd students at your school. How do you expect pooled testing when the system gets in place next week? How do you expect that process to go?
Great. So we will be testing all students who opt in to pooled testing, one class at a time. We will be completing that testing outside of our classroom. So either, right outside that classroom door, or, as you mentioned earlier, a lot of our classrooms are in larger multi-level buildings. We'll be testing students outdoors, a few students at a time so we can support our little ones as needed. In swabbing their nose, students wash their hands, remove their masks, swab each nostril, make 4 circles in each nostril, place their testing Q-tip
Instrument.
excuse me, thank you, in the vial, and then wash their hands. I anticipate, I'd love to see as many families opt in for testing by Friday, so everyone, as many people as possible can participate. But I anticipate, like many things we pilot, right? When you do things well, or when you make adjustments to a new practice, and families begin talking about how that goes, and you hear from your child's principal about how the first week of pool testing went, it just gives families more context in making that decision of whether or not they want their child to participate. So will there be, it's the first time we're doing this. We'll certainly make adjustments along the way, but we're trying to plan for as many details as we possibly can, so it will start off in a really positive way.
And I want to pick it up there, Amanda, to explain to the families and to explain to our district staff how we got to this point of implementing pooled testing. We have a department here at the district called Student Services. And we have a person that works with us. Her name is Susie Riley. We talk about her a lot in these presentations. She's like the sweetest person you've ever met in your entire life. If you haven't met her, she's just amazing. But she spends 10 to 12 hours a day on the phone with principals and parents and teachers and nurses, explaining what is going on with COVID in our district. So when we reached the end of the first week, we started to pick up steam in terms of implementing pooled testing. We were one of the first districts to go out and reach out and try to implement it in the region. And what we wanted to do was we wanted to devote a person who could have the uninterrupted time to plan it. And so there's another member of the department, her name's Stephanie Gibson, and Stephanie is a total professional. And she has a different job. Her job is called enrollment, coordinator of enrollment. And we basically pulled her in and said, Stephanie, for the next 3 months, you are the coordinator of pooled testing. We're going to take all your job duties and we're going to assign them to others, or come up with a plan to sort of keep them going by also reducing the amount of time you spend on those duties. Because pooled testing is not something we do. It's something an external company comes in and does. But here's the issue. We have 21 schools in this district. 21 bell schedules, 21 principals, 50 school secretaries, 600 teachers. So Susie Riley cannot spend all day on the phone talking about COVID and also plan a brand new, completely out of the blue, scratch project for pooled testing. And that's where Stephanie Gibson came in. So for the last month, she's been coordinating with principals, district departments, and the company that's going to do the pool testing. Now, I won't get into all of the gory details or the palace intrigue regarding what happens when you work with external vendors, but there's a new surprise every day. You think that you're going to do something in a certain way, and then it changes. You think that something's going to happen, and you get an email saying it's going to be a little bit different than that. So it's kind of like the topic that you brought up where you said, before we came online, you said, Diego, we just had a meeting today with our district staff, and they made it sound like we could give the swabs, the 4 swabs in each nostril, outside of the classroom. And you said, can we tell people that that's possible? And I said, yeah, but a week ago, I didn't think that was possible.
Absolutely.
And that's why these events are so important, because things change and questions come up. And then we ask the honest question, can we do some of these tests outside? Now, if it's sprinkling outside, I doubt they're going to do it outside. If it's really cold outside, I doubt you're going to take kids out to do it outside. If you happen to be in a school where the classrooms are more packed in, it's probably not feasible for everybody to do it outside. So I think every school's a little bit different, and that's okay. That's what you described and said. You might do it and decide, this is exactly what I thought, and I want my child to do it. And we probably have hundreds of parents who are going to see how it goes the first week or the second week. And we feel good about that, because the other thing that's just around the corner, we believe it's about 6 weeks to 8 weeks out, is there's an expectation that a potential Pfizer vaccine for children will come out. I was contacted today by a newspaper asking what I thought about a vaccine for children, ages 5 to 11. So I'll tell you all. The Centers for Disease Control and the California Department of Public Health have both identified vaccination as the #1 tool to mitigate COVID transmission. So I'm in favor of vaccines for COVID. Right now, we have 12 and 13-year-olds who go to school with us who are vaccinated. And I want to encourage parents, take your 12 and 13-year-olds to get vaccinated. When and if there's a vaccine available for 5 to 11-year-olds, I'll take the same approach. Strongly encourage vaccination, with the acknowledgement that for some families that doesn't work, and that's okay. The state of California has a process for employees in schools. You are either vaccinated or you test every week. That provides a fairness and a safe environment for people that work for us. So I think that's a very likely outcome. I want to thank all the families that are submitting their live chat questions. I'm going to ask Diego to give me my first. There we go. My first sheet. Each one of these is a different topic, a different question. We've got the first question. Actually, this came up in our review. Myself and Amy and Patrick were reviewing the presentation from May 6th. And the word that popped out to me that I didn't I said, oh, this is not a great word that we used at the time. But the presentation that's online on the district website on May 6th on the board documents, it states, the district will install CO2 or carbon dioxide monitors soon, was the phrase that we used. And we said, well, that's gonna mean something different to each person. So Patrick, talk a little bit about those CO2 or carbon dioxide monitors and the timeline for installation.
Yeah, so we've taken a couple steps looking at the CO2 monitors and installation. And within our district, we have some systems that have the capacity to have a CO2 sensor installed and activated. And we have some sites that don't have the capacity to house those CO2 sensors at all. And what we spoke about last time too was in conjunction with the HVAC project that we spoke about, the sites that the superintendent shared a few minutes ago that don't have air conditioning also don't have the capacity to house these CO2 sensors. And so those CO2 sensors will be installed when we do the construction this upcoming summer. And you cited those, that's part of phase one. There is another set of sites in the district that do have air conditioning. You read through some of those that do have the capacity to house a CO2 sensor. We are working with a partner who has done site walks with us along with our staff. We also did a pilot test at one of our older school sites, Bayside, and one of our newer school sites, Fiesta Gardens, to test these CO2 sensors. So part of our pilot in the installation of those CO2 sensors was to determine if the systems that they're installed in that are also throughout these other school sites, if those CO2 sensors will work and will interface with our system. The pilot was successful. Those systems do interface. Those devices do interface with our systems. And so we believe, in talking to our partner, that by the end of September, we'll have an estimate from them about what the cost and time frame will be to do the installation of CO2 sensors in the sites that are not part of the construction that will be done this summer, right? So we have sites that are not part of the Measure T HVAC overall construction that we can install these sensors in because they will not be upgraded as part of the bond project. And we also have sites that are part of the phase 2 modernization of Measure T that we have the ability to install these sensors in. So this month, we anticipate receiving from our partner an estimate of what cost will be, an estimate what time will be to do these installs. I can share with you that the installs that were done at both Bayside and Fiesta Gardens were not terribly time consuming. It's a matter of swapping out. I mean, at home, you think about swapping out a thermostat. What does it take to do that, right? That regulates the temperature in your house.
Well, I tried to do it.
Then you called somebody.
It took me 5 hours.
Yeah.
I broke 2.
Yeah.
I still can't turn the AC on. So are we talking like a home install or more of a professional?
We gotta do this. So this is, and then we gotta get some scope of what the cost is gonna be. So then there's all these parameters we have about what needs to go out to a public bid, et cetera, et cetera. So once we get that estimate this week, we'll work further and we'll provide the board and the community an update on what's happening with the next steps of that too. So that's kind of a condensed version of what's happening with that CO2 stuff.
Thank you. There was a question about, I don't want to pronounce it wrong, but AEDIS or ADIS.
Oh, okay.
Will you talk a little bit about that?
Oh, sure. So ADIS is just, I'm not sure what the particular question is, but ADIS is the architectural firm that they did work for us on our overall facilities master plan. Okay. And then they did an assessment for our entire HVAC system. And then we signed a contract with them initially for the phase 1 projects. And what ADIS conveyed to us is that they felt that taking on all 15 sites was a really big project for them. So initially, although we signed a contract with ATIS in February for phase one, their initial conversation with us is we don't want to take on too much and under deliver. But subsequently, after they did some initial work on phase one, while we were anticipating going to the pool of other architects to perhaps enter into a contract with another architectural firm, we had a subsequent contract or conversation with ATIS about them doing phase two because we thought there's a lot of leverage and momentum we'd have with that project. So we subsequently entered into a contract with them. I want to say it was in June for phase two. So they're doing the design to go to DSA for both phase one and phase two. They did the overall HVAC assessment for us prior to entering the contract, and they were also the firm we partnered with who did our whole facilities master plan.
Okay.
So that's kind of that time frame. They worked with us prior to the bond to do the facilities master plan, and then after the bond passed to do this is a huge priority for us as a district because of, I think even prior to COVID, it was a big priority for the air conditioning component, right? Yeah. Kids' comfort and the correlation between that and being able to focus, right? And then, so I'd be repeating myself, but that's kind of the steps we took at ATIS.
We have some pool testing questions, so I'm going to turn back to you, Amanda. You've got 5-year-olds that go to school, and I'm a father. I have 5 kids, 18, 16, 6, 4, and 2. So I asked my 6-year-old, because he's in first grade, I said, get this Q-tip and copy your daddy. And I just took the Q-tip and did 4 circles in each nostril, and I asked him to copy me. And it was pretty seamless. He followed along pretty well. What would you like parents to do? What will the school do to help those little guys properly swab their nostrils?
Great question. I can relate to the parent piece as well and doing it with my own children, but it's helpful to think about it in the context of the classroom as well. I think parents can, and one way to support as this work as we move forward with pool testing is it's helpful to practice these things, whether that's simply talking about what that's going to look at. Like, I even think this visual of the steps could be easily used with children as well to model what each part of the process will look like. Just like anything, starting school, going to the doctor for the first time, getting your teeth cleaned, having conversations with our children that are participating is really helpful. Maybe even modeling it at home, what that will look like. Perhaps you or your family has already participated in testing at one of our sites, and kids might be a little bit familiar. I also hope it's reassuring for families to know that staff will be there to support as well. In the same way that we support our students, we do support them in adjusting their mask whenever needed, right? A 4-year-old's mask falls off and they might need assistance getting it back over both ears, right? So we use all of our mitigation practices, of course, when we do that, but we're going to be there along the way as they do this for the first time. And with more practice, just like many things, our little ones, our big kids and our little kids are so very capable of doing new things with our support.
The other question was about cross-contamination. I think what families want to know is, will kids be right next to each other? Are they ever going to touch each other's instrument?
No, they'll be spaced away from each other. They won't be facing each other. And I envision us working with a few students at one time rather than trying to test many children at the same time. And as we get better and learn how to do this even better, we'll make adjustments as needed. But I envision starting with a few students. And no, they're not close to other children, just like when they're eating lunch, they're not, we're reinforcing keeping proper spacing when you have your mask off.
That's right, because many students are actually pulling their masks down 10, 15 minutes at a time and chewing and drinking, blowing their nose, coughing when they're eating lunch. But because others are masking up, because even the students who might do that, they pull their mask back up. Remember, they're still, even though they're swabbing their nose, all it takes is
To pull it down, or even I'm thinking, I envision, and I'll know more next week, but I envision even some of our older students might be able to pull the mask out from their face in this way. So we'll model those, right? We'll model what it looks like, do it with them, and have them start to do that on their own.
there's a question about how we estimate the percentage of false positive test results. Those research studies are done. It's an extremely low percentage of false positives. I won't guesstimate at what it's going to be in the San Mateo-Foster City School District because I don't know. What I can tell parents is we believe in this strategy as a additional layer of mitigation because the research tells us that it works, and the research tells us that it's safe and that it's effective. We also got a question about when 7th and 8th graders will start testing at the middle schools. And so the very first week we're going to initiate with 6th graders. We believe that starting with 7th and 8th graders is not far down the road. Again, because we are working with an external provider, we can't make any 100% guarantees. But within a week or two is when we expect to start with some of the older students at our middle schools, noticing that those older students, many of them are also already vaccinated. So the risk, again, lowers greatly when you have vaccinated students in that group. We got a couple of questions about the live stream. That's fun. The first question is this the last scheduled YouTube live stream? It's the last one we've promoted, but it is not the last one. We are going to promote an upcoming YouTube live stream that is going to focus on board and community workshops and the strategic plan process. The district is currently going through a process called the strategic plan. It's rigorous, it's data-based, it's student-focused, it's community-created, and it's going to make students the center of our decision-making for the next 5 years. And I want to engage with parents about that process. So we'll be excited to put that one out. The committee has 40 people on the committee. So we will not have 40 people in this room. I know it looks to you all like we have 40 in here. We'll have a small group join me to talk about the strategic plan and about the board community workshops. We have a question on how many of the kids who were positive on the PCR or on the very likely the Virus Geeks testing program were actually asymptomatic and doing fine. And because we get new cases of coronavirus every day, the percentage changes, but a very, very high percentage of our students are asymptomatic, which means they don't feel sick. They don't have a headache. They're not coughing heavily, but they are positive for coronavirus according to the test that they took. The percentage is very high. It's not 100%, but it's definitely in the 80% range and above. And again, it does change because we get new cases and then that gets factored into the number of kids who are asymptomatic. Now, what I want to do is thank families for joining us. We're going to log off here in just a second, but myself and Principal Driscoll are going to stay and conduct a YouTube live stream in Spanish para las familias que están con nosotros ahorita. En este evento vamos a seguir en 5 minutos en español en su pantalla, en su computadora. Esperemos que estén ahí con nosotros. So we want to thank all of our families for being here. We have a American Sign Language interpreter behind me doing an absolute wonderful job. Let's give him a round of applause. And thank you all for being with us tonight. We'll see you again in a few weeks. All right.